Hello and welcome. Thanks for joining me today for a Medicare neighborhood meeting. Let's start with who we are and what we do. People across America trust Wellcare for coverage that goes beyond basic Medicare. Medicare Part D prescription drug plans from Wellcare offer you affordable coverage on the prescription medications you need to help you live a better, healthier life. Wellcare Medicare Part D prescription drug plans make it easy for you to fill your prescriptions. Our network includes national, regional, and local chains, plus independent neighborhood pharmacies. With medication home delivery, you can have maintenance medications delivered right to your mailbox with free shipping. Plus, all 90-day fills of Tier 1 medications are available for $0 copay. Today you'll learn about the basics of Medicare and why a Wellcare Part D prescription drug plan can be a great choice. Hosting this event is a licensed Wellcare plan representative. Selecting a Medicare Part D prescription drug plan can be complicated, but we're here to help. This easy-to-follow video explains Medicare in simple language. It covers everything you need to make a good decision about your Medicare Part D prescription drug coverage and to enroll in a Part D plan. It also explains how a Wellcare Medicare Part D prescription drug plan can provide coverage for the medications you need to live a happier, healthier life. Let's start with the basics. What is Medicare? Medicare is a program administered and regulated by the Centers for Medicare and Medicaid Services. You're eligible for Medicare if you are a citizen or permanent resident of the United States, age 65 or older, under 65 with certain disabilities, any age with end-stage renal disease, ESRD, or amyotrophic lateral sclerosis, ALS, also called Lou Gehrig's disease. This video will help you understand Original Medicare and how it compares to Wellcare Medicare Advantage plans. Part A, Hospital Insurance. Part A covers inpatient care, a skilled nursing facility, hospice, and some home health care. You'll still have out-of-pocket costs for your hospital stay, like deductibles and co-insurance. Part B, Medical Insurance. Part B helps with the costs of doctor visits, outpatient services, and some preventive services. With Part B, there are additional costs you have to pay, such as a monthly premium, annual deductible, and co-insurance. Parts A and B together are called Original Medicare. Part D, Prescription Drug Coverage. Wellcare Medicare Part D prescription drug plans help to cover the costs of prescription drugs. Many of our plans offer low monthly premiums and low copays on the medications you take to feel your best. To receive drug coverage, you must purchase a prescription drug plan to add to your Original Medicare, or enroll in a Medicare Advantage plan with Part D prescription drug coverage. Part C, Medicare Advantage. Medicare Advantage, or Part C, provides all your Part A and Part B coverage in one plan, offered by a private company like Wellcare. Medicare Advantage plans may offer extra coverage, such as dental, vision, and hearing coverage, and often include Part D prescription drug coverage. We've covered the basics of Medicare. Now let's make sure that you understand the basics of Medicare Part D prescription drug plans. Medicare Part D is coverage for prescription drugs. You don't automatically get this coverage when you become eligible for Medicare, yet many Americans rely on prescription drugs to maintain their health and well-being. To receive drug coverage, you can join a Wellcare Medicare Part D prescription drug plan. Medicare Part D prescription drug coverage includes 4 cost-sharing stages. The amount you pay to fill your prescription drugs depends on the payment stage you're in. Deductible. The amount you pay before a plan covers your prescription drug costs. Some Wellcare plans have no deductible. Initial coverage. During this stage, the plan pays its share of the cost and you pay your share. You're in this stage until your payments and the plan's payments total $4,660 for the year. Coverage gap. When your drug costs and the plan payments for the year reach $4,660, you enter the coverage gap stage, commonly known as the donut hole. You will pay 25% of the cost for formulary, generic, and brand name drugs. You will stay in this stage until your out-of-pocket costs for the year reach $7,400. Catastrophic coverage. After your out-of-pocket costs for prescription drugs reach $7,400, the plan will pay most of your drug costs for the rest of the year. You will pay either 5% of the cost of the drug or a copay of $4.15 for generic drugs and $10.35 for all other drugs. Next, let's discuss how you'll determine your drug costs. Our plans group each medication into tiers. You will need to use a formulary to determine what tier your drug cost is in and how much it will cost. The amount you pay depends on the drug's tier and what stage of the benefit you have reached. What is a formulary? A formulary lists the drugs your plan covers. Our licensed sales representative has a copy of the formulary and can help you look up the medications you take. Find out if you qualify for Extra Help. Extra Help is a Medicare program that helps people who have limited income and resources pay for Medicare prescription drug program costs like premiums, deductibles, and co-payments. Depending on your income and resources, you may qualify for Extra Help. To find out if you qualify, simply call the Social Security Administration at 1-800-772-1213, Monday through Friday, 8 a.m. to 7 p.m., or visit ssa.gov. Now let's talk dates. Initial coverage election period. This is the time when someone first becomes eligible and can sign up for Medicare. For most people, it begins 3 months before their 65th birthday month and lasts 3 months after their 65th birthday month. Annual enrollment period. The annual enrollment period for 2023 starts on October 15, 2022 and ends on December 7, 2022. During this period, you can enroll into a Medicare Part D prescription drug plan or Medicare Advantage plan from Original Medicare. Enroll from one Medicare Advantage plan to another or Medicare Part D prescription drug plan. Enroll into Original Medicare from a Medicare Advantage plan. Medicare Advantage Open Enrollment Period. The Medicare Advantage Open Enrollment Period starts January 1st and ends on March 31st. During this period, you'll have a one-time opportunity to enroll from one Medicare Advantage plan to another, enroll from a Medicare Advantage plan to Original Medicare, with the option of enrolling in a Part D standalone prescription drug plan. Special enrollment periods. You could qualify for a special enrollment period during any month when certain events happen in your life, even if it's outside of annual or open enrollments. You may qualify for a special enrollment period if you move, you are eligible for Medicaid, you qualify for Extra Help with Medicare prescription drug costs, you're getting care in an institution like a long-term care hospital, you lose your employer group coverage, or you are enrolled in a state pharmaceutical assistance plan. It's important to sign up when you're eligible to avoid paying a penalty. And don't worry, you can get all your medications during your transition. All new Wellcare members can get a temporary 30-day supply of Part D prescription drugs anytime during the first 90 days of joining our plan on most covered drugs. Now let's take a look at our medication home delivery service. If you take medications regularly, our home delivery service through CVS Caremark lets you have a 90-day supply of your medications mailed safely to your door. Plus, CVS Caremark will automatically refill your prescriptions at no extra cost. Medication home delivery is convenient in many ways, including copays as low as $0 for a 90-day supply of all Tier 1 medications filled at CVS Caremark. Medications are delivered right to you, saving you trips to the pharmacy and at the gas pump. Prescriptions are delivered in discreet packaging, and you can receive status alerts by email, phone, or text. Take advantage of all our medication home delivery service has to offer: convenience, safety, free shipping, status alerts, and big savings. To get started today, ask your licensed representative for more details. Next, let's walk through our plan's coverage so you'll know what choices are available. Wellcare offers several plans with different levels of benefits, depending on how much prescription drug coverage you need to support your well-being and help you live a better, healthier life. If you qualify for extra help, choose our Classic plan. Depending on the level of extra help you receive, you may pay no monthly premium and lower copays than those listed in the summary of benefits. After you have enrolled in a Wellcare Medicare Part D prescription drug plan, Medicare will tell us the level of extra help you will receive, and we'll send you information on the amount you will pay. The Classic plan includes a broad range of preferred pharmacies like CVS, Walgreens, Amazon Pharmacy, and many grocery chains where you may save more. If you qualify for extra help, you will pay no more than your subsidized copay regardless of what pharmacy you use. If you don't qualify for extra help, you will pay the copays listed in the evidence of coverage. If you want a low premium, Wellcare offers a plan to meet your needs. The Wellcare Value Script Plan provides you with low premiums, no deductible on Tiers 1 and 2 medications, copays as low as $0 at preferred retail cost-share pharmacies like CVS, Walgreens, Amazon Pharmacy, and many grocery chains. Members enrolled in this plan also pay lower costs for insulin medication and have access to a low-cost drug tier designed for medications commonly used to treat diabetes. Need more coverage? Then you may be interested in our plan with $0 deductible, Wellcare Medicare RX Value Plus. There's no deductible for all prescription drug tiers, and the plan begins covering your prescription drug costs the first day of the plan. You also get in-store copays as low as $0 at preferred retail cost-share pharmacies, which include CVS, Walgreens, Amazon Pharmacy, and many grocery chains. Plus, members in this plan receive lower-cost insulin medications and have access to a low-cost drug tier designed for medications commonly used to treat diabetes. Let's review 5 good reasons to choose Wellcare prescription drug plans. Plans with low monthly premiums. Wellcare PDP may be one of the lowest cost plans available in your area. Our plans offer affordable coverage on thousands of prescription drugs. Value that saves you money. All plans offer copays as low as $0 at preferred retail pharmacies, and some plans have no deductible. Pharmacies available across the country. Wellcare Medicare Part D prescription drug plans make it easy for you to fill your prescriptions. Our network includes national, regional, and local chains, as well as some independent neighborhood pharmacies. Medication home delivery brings convenience to your door. You can have a 90-day supply of your medications mailed safely to your door with our medication home delivery service through CVS Caremark. Caring customer service. As a member, you'll have access to a customer service team that will explain your coverage and how to make the most of your benefits. Need help finding a pharmacy or filling a prescription? It's just a call away. Ready to sign up? We make it easy. You can enroll by meeting with your licensed representative, by visiting us online at www.wellcare.com/PDP, or by calling 1-877-MY-WELLCARE, 8 a.m. to 8 p.m. 7 days a week. After you've completed your enrollment application, You'll receive important information and materials about your new plan, including your ID card and a member welcome kit. Thank you. Please tell your friends and family about your decision and the reasons why you have selected Wellcare as your prescription drug plan.